Hi, everyone. I'm Jeralise Diaz here with the Record Journal. We're here with our new weekly segment, Ask the Expert, in partnership with Hartford Healthcare's Midstate Medical Center, Community Health Center, the United Way of Meriden and Wallingford, the Spanish Community of Wallingford, the state of Connecticut, and the Connecticut Department of Public Health. We'll talk about various aspects of the vaccine rollout and have a medical expert answer a weekly question. Today, I'm joined by Dr. Ann Palmer, Hartford Healthcare Division of Infectious Disease.
Hello, everyone.
Hello. This week's question is, should someone who is pregnant, considering becoming pregnant, or breastfeeding receive the vaccine? What do they need to know?
Okay. So, hi, Jeralise. Thank you for having me here. So there's three parts to this question. Okay. So the first thing is in terms of pregnant women who are currently pregnant. So it hasn't been approved yet for pregnant women per se, as they were not included in the initial studies. However, there is ongoing trials right now studying vaccine and pregnancy. But having said that, and if we go by the science behind the vaccine composition and how the vaccine is made, we think that it's pretty safe to use in pregnancy. And actually, there's been thousands of women that have had a discussion with their primary provider and weighed risk and benefits, especially women who may have certain diseases or conditions that predispose them to have severe COVID-19 if they were to become infected. And they have been vaccinated successfully without no reported side effects. But we still, like I said before, have now ongoing trials in pregnant women. The second part, I forgot you already asked me the question. The second part of the question is, are women that are thinking about becoming pregnant, should they get the vaccine? So far, there is no contraindication whatsoever. There is no evidence in any of the studies that we have currently into thinking that the vaccine can cause infertility or that women in childbearing age should not get the vaccine for fear of this. Actually, there were plenty of women in the original studies who got pregnant after receiving, being fully vaccinated with the vaccines while they were doing the trials. And so far, there is no correlation or there's no evidence to suggest that the vaccine should not be used in this scenario. So they can go ahead and get vaccinated. The third question is, can women that are currently breastfeeding, get vaccinated? And again, we have very little data on lactating women. However, again, going by how the vaccine, the science behind the vaccine composition and how the vaccine is made, there is no live virus in this vaccine or dead virus. So there should be no contraindication whatsoever for women who are breastfeeding. And actually, we know there's antibodies in the breast milk, and this actually could be beneficial for the infant. Does that respond to your questions?
Yes. Okay, so thank you, Dr. Ann Palmer, for joining us today, and thank you all for watching. Tune in next week for our next Ask the Expert. If you have any questions and would like them answered, leave them in the comments and we'll add it to our list. Thank you again to our partners for making this possible. Hartford Healthcare's Midstate Medical Center, Community Health Center, the United Way of Meriden and Wallingford, the Spanish Community of Wallingford, the state of Connecticut, and the Connecticut Department of Public Health.